How's it going, guys? We have a difficult question for pharmacology for step 1, family internal medicine 2CK. Before we get started, please subscribe to my channel. I really appreciate it. Give the video a like, really appreciate it. Find me on Instagram, Mehlman_medical, MEHLman_medical. Links down below for me, Telegram, links to the Telegram group and channel down below. Let's start the clip. 69-year-old man, he has Parkinson disease. And he also has post-traumatic stress disorder managed with an SSRI, sertraline. Which of the following agent is most appropriate to avoid in this patient? Let's just hop through. Choice A, amantadine, wrong fucking answer. Now, some of you are going to get emotional because, in theory, amantadine could be avoided in this patient, but it's not the best answer, and I'll explain as we move through, okay? But amantadine, as you need to know for USMLE, the mechanism of action is that it increases presynaptic release of dopamine, okay? There are side effects you could be aware of for amantadine, nonsense low yields such as livedo reticularis or ataxia. Wrong fucking answer. Choice B, bromocriptine, wrong fucking answer. So it's a D2 receptor agonist that could be used for Parkinson's disease, but classically used for prolactinoma and USMLE. That's its high-yield use case. There are other D2 agonists that could be used for Parkinson's disease: pergolide, pramipexole, ropinirole. Wrong fucking answer. Choice C, carbidopa, levodopa, wrong fucking answer. So levodopa, precursor to dopamine. If we give dopamine peripherally, inject the patient with dopamine, it's going to cause cardiovascular effects. That's why we don't want to do that. If we give levodopa alone, the precursor to dopamine, this will be degraded by enzymes prior to crossing the blood-brain barrier, okay? So by giving carbidopa, this could effectively act as a competitive inhibitor. Some people don't like that terminology, but for the sake of conceptualization, this can act as a competitive inhibitor of breakdown enzymes so that levodopa is not broken down. So this will increase what USMLE wants you to know, okay? This is going to be the answer in the NBME. They ask, why are they paired together? And the answer is increases blood-brain barrier penetration of levodopa, okay? That's what you need to know. For 2CK psych forms, you have to be aware that this combination can precipitate acute psychosis in patients if the dose is too high. So what they're going to do is tell you a patient is started on levodopa, carbidopa, and has visual hallucinations or auditory hallucinations, okay? And they say, what's the next best step? And discontinuation of carbidopa, levodopa is wrong. The answer is just simply decrease dose. Wrong fucking answer. Choice D, selegiline, correct answer. So the selegiline is a monoamine oxidase B inhibitor, which preferentially prevents the breakdown of dopamine over other neurotransmitters. Now, we want to avoid monoamine oxidase inhibitors in patients who are on drugs such as SSRIs or taking supplements such as St. John wort to avoid serotonin syndrome. And the NBME asks this pretty much identical question on one of the offline forms. Now, as I prefaced with amantadine, technically, if you give a drug that increases presynaptic release of dopamine, it could, in theory, increase the release of serotonin syndrome. But if you're confronted with answer choices where there's potentially an equivocation, you say, well, are you sure selegiline's clearly the better answer, okay? Because it's a high yield point, you know, that monoamine oxidase inhibitors 100% need to be avoided in patients who are on other antidepressants. And if a patient is taken off an SSRI and there's not enough of a lag or enough of a break between commencing the monoamine oxidase inhibitor, that can also cause a serotonin syndrome. Real quick, tolcapone, wrong fucking answer. Catechol O-methyltransferase inhibitor. It's an enzyme that breaks down dopamine and other catecholamines. So it's a pretty much non-existent drug for all intents and purposes for USMLE. Wrong fucking answer. You know the deal. To make more content, if you like my stuff, subscribe my channel. Appreciate your time. That's it.